Hello, I'm Sharlene.
I'm Roylin.
And I'm Haly from Help Academy, and we are Team HelloWorld. We chose Theme 1, and our idea for this hackathon is MyJourney, in which we will mainly focus on its algorithms.
MyJourney is an app or program that collects patient data to optimize Roche's business solutions and customer experience. MyJourney also provides features like tracking and storing their patients' daily conditions, managing hospital visit schedules, and suggesting personalized health guidelines using the collected data.
But how can MyJourney help and enhance patient experience? Here's a sample scenario. This is Amanda. She's diagnosed with stage 2 breast cancer and is living alone during this pandemic's peak. Amanda just got a phone call that her hospital appointment got postponed to further notice because of COVID-19. The doctors feared that she'd get the disease from hospital exposure, especially since her immune system is weak from chemotherapy. So now she waits. It has been 3 months, and Amanda has finally caught up with her long-awaited appointment. Many things had happened during those 3 lonely months, but Amanda couldn't remember every change in her body, so she did not update her doctor. Unknowingly, she had skipped out on the fact that during those 3 months, she had actually been feeling down most of the time, and not to forget that she had also lost 5 kg in weight. These emotional and physical change could potentially be a factor of tumor growth. However, with the lack of data, like Amanda's newly developed depression, Amanda's doctors can't address that and continue to assume that the prescription they gave her months ago is still applicable without any antidepressants that she clearly needs. But bad news! Amanda discovers that her tumor has continued to grow on her next appointment. But how come? It couldn't possibly be her subtle depression that triggered her tumor growth, right?
On the other side of the world, there is Brandon, diagnosed with stage 2 multiple myeloma, also known as bone cancer. Brandon was counting days until his next appointment. After all, he wasn't expecting himself to get cancer, and he really needed to know more just for the peace of his mind. On the day of his long-awaited appointment, Brandon meets the doctor and he gets a list of prescriptions. But wait, one of the drugs he needs to collect is out of stock. Brandon is now frustrated and angry. On top of having cancer, now he has to wait for his medicine? What if this delay causes his tumor to grow bigger? Anxiety, the very thing that might catalyze his condition, rose in Brandon.
These stories do not only apply to only Amanda and Brandon. All over the world, millions of cancer patients today face similar problems. Oncology drugs in general have lower demand compared to common disease drugs. So, the required stock of these drugs cannot be estimated by hospitals, and as a result, hospitals don't know how much to order. This inconveniently causes shortages, sometimes for customers like Brandon, and is increasingly becoming a problem, and it happens all around the world. This inefficiency can be improved to help both patients' experience and Roche's supply chain.
Besides, in the midst of COVID-19 or similar cases, less appointments are available for cancer patients. Doctors have limited means of accessing patients, and there will be no certainty that the prescription of medicine is applicable when patient data and progress is unknown for months until the next doctor's appointment. Patients' conditions change constantly. Specific prescriptions pertaining to these changes is difficult with lower frequency of appointments. This means that patients may possibly overdose on the drug unknowingly in between their wait, which if can be solved, it can help enhance Roche's personalized healthcare scheme.
And MyJourney can help. How, you may ask? MyJourney will ask a set of questions on patients' conditions every day. These collected data will be periodically cleaned and sent to hospitals, letting the doctors know how the patient is doing, even with less appointments. Now, doctors don't have to rely on Amanda's memory for prognosis.
MyJourney will also run the collected data through a predictive analysis algorithm to examine the patient's conditions and give the corresponding medication needed. With this, Roche and hospitals will know how much stock they should keep. Now, Brandon doesn't have to be stressed out about his pending medicines.
Besides, this clean and analyzed data will be sent to hospitals as well. With bigger, more reliable data, patient prognosis will get more accurate, enabling healthcare personalization. Now, Amanda will receive medication and treatment fit just for her. But that's not just it. MyJourney will also have features like motivational quotes, connections to support groups, patient calendar, pill reminder, and daily healthcare suggestions. And it's on a simple user interface catered for both caretaker and patient.
In short, on the oncology front, there is inefficiency in supply chain flow and insufficient or inaccurate patient data. MyJourney will collect, analyze, and connect patient data to hospitals and Roche. This will enable pre-planning and enhanced personal treatment, ultimately optimizing customer experience and providing business solutions.